Hi, this is Brandon with Chiro. I want to talk about impingement syndromes of the hip. And we find this often with our younger athletes with a lot of repetitive strain, especially when they're doing any kind of deep squatting or biking activities. And a quick background on impingement syndrome, from this graphic here you can see that there's two specific problems that could happen. The first one being a cam impingement, and that's a problem with the femoral head. That femoral head needs to fit into the acetabulum. And if there's overgrowth of the bone or any kind of bony impingement there, usually on the anterior superior aspect of that femoral head, when it goes to flex, it gets pinched right there at the acetabulum, causing pain. If there's a problem over here called pincer type of impingement, then there's an hypertrophy of the cartilage along that labrum, causing the same kind of impingement when you cause any kind of hip flexion. So what I want to do with my patients is quickly screen them to find out if they have a impingement syndrome. And I have 4 simple tests to do that. The first one being the Fatir test. So what I'll do with Fatir test is passively bring the hip up into flexion, adduction, and some internal rotation, and then a little bit of scouring in there to see if it causes any kind of pain. A positive test will cause pain in the groin region and will not be radiating down the leg. I can also further scour that joint with my Quadrant test. So I can do the same thing with bringing the knee up into flexion and then test the range of motion of the hip, seeing if the patient's having any pain in the groin area. Now that is not positive or a differentiating test between cam and pincer impingement. That just means that I have impingement. However, if I do a Fatir test, which is bringing the leg into some external rotation and adduction and causing a little bit of downward pressure, and that causes pain, that's usually more of a pincer type impingement. And the reason is because the leg is no longer shearing or causing compression along that anterior superior aspect of the acetabulum. So if it causes pain here, I'm actually just pulling at that top part of the labrum. The same thing with the posterior impingement test. Can I be laying your side and face the wall away from me? And with the posterior impingement test, I'm going to passively bring the leg back into extension, and I can also flirt with a little bit of internal and external rotation along here, so I can pull at all aspects of that labrum. If that causes pain, now I think I'm dealing with more of a pincer type impingement as compared to a cam impingement. Obviously with a cam impingement, radiographs would be a great option to start with as far as making that diagnosis. Now as far as treatment with any kind of impingement syndrome, this is best dealt with at the initial phase conservatively. Check out Chiro for the conservative management as far as rehab exercises and also the advice on daily living to help get these people out of pain quickly.